I'm going to be talking to you guys today about preclinical intraparenchymal applications for gene therapies, specifically in the non-human primate brain. The delivery method is very exciting, and this is what I'm going to be focusing on. You can choose many different ways to get into the central nervous system. Some therapies do best with a direct intraparenchymal injection targeting a very specific neuronal population. For example, in Huntington's disease, you'd want to target predominantly the caudate putamen or other basal ganglia areas. And the spinocerebellar ataxias, due to their name, you really want to stick with the hindbrain, including the cerebellum and the brainstem. For global delivery for more ubiquitous diseases like Alzheimer's or lysosomal storage diseases, you would want to cover kind of more reality and use an intraventricular intrathecal, or like Natalie was saying, the golden pot of gold at the end of the rainbow, the systemic delivery that would skip the liver and everything else, go past the blood-brain barrier, and then saturate the brain. And so we're going to be talking about directed injections, specifically targeting Purkinje cells in the cerebellum. And you could do stereotaxic injections, which are very reliable in mice because they're very small. Or when you scale up to non-human primates, and then hopefully with an eye on clinic, you would use more of an MR-guided intracranial delivery platform. I'll be talking about ClearPoint technology here. And so for this, we know that there is your technique needs to be scalable. It needs to be streamlined, and the FDA and the EMA like to see a preclinical design very much like what will happen in clinic to minimize the changing factors when you get there. And so for that, we like to use ClearPoint, which is the intra-MRI neuronavigation surgical delivery platform, which the brain surgery is conducted directly in the magnet. It is all cleaned and sterilized into a surgical space. The head is fixated in a frame here to hold it steady when it's taken to ISO center in the MRI. And then the tower actually attaches to the skull so that you can deliver your targets directly from there. It's been approved since 2010, which makes translation of this very, very nice. And so this is actually a rhesus macaque brain. For targeting our hindbrain, we wanted to transduce predominantly the DCN, the deep cerebellar nuclei, the dentate here, and then the vestigial and inner post in the middle. So we're targeting it with 3 injections to the hindbrain. This is kind of a scalable reference with the centimeter marks here, the human, the monkey, very much smaller. And then the stereotaxic smart frame in particular, with humans, you have a much bigger skull. You can probably fit 2 on at a time and minimize your time in the actual surgical MRI. With the monkeys, you have a very limited real estate on the primate skull. So get to know your radiologist and come up with some interesting ideas of placement. Play around with different size of the MR array coils that will not only give you good specificity in scanning, but also enough free space for the tower and the cannula to have access to whatever space you want. Take your time with the injection rates, usually scaling up from a very small rate to a slightly escalated dose, especially when going intraparenchymally. You want the CSF intracranial pressure to be able to adjust to the increased volume that you're adding to this relatively closed space, and allow time for the injection to dwell, so as not to rip the cannula out very quickly and have everything escape through the needle track. And then with that, if you follow all these things, you can attain perfection. This is a little gadateridol added to the AAV virus. And as you can see, we are hitting our 3 target spots specifically. In between each injection, it's usually about 45 to 60 minutes to retarget, usually going on the side of the skull and only making 1 borehole and being able to hit all 3 targets, even crossing the midline, avoiding any brain vasculature. And ClearPoint allows for the perfect way to do that. And we are very sure that this will be able to scale it to humans going into the hindbrain areas. I'd like to thank everybody in the Davidson lab, the comparative medicine core, which helps with all of our primate work. We have 2 really great AAV and lentivirus cores, the research vector core and also a GMP clinical vector core. Everybody at UPenn, Tim Lucas was seminal in making all of this work, my radiology friends, and then my funding.